Chapter 12, the StretchFlex Technique. A stretch a day keeps the surgeon away. The StretchFlex technique can be overlaid onto any stretch that you already know, and it just requires one more step. When you do a normal stretch, notice where the pain is. The pain is the tight muscle being stretched. While you're at the end of the stretch, focus on precisely where the pain is located. Begin to flex that muscle in the opposite direction. Now, when doing this, one always needs resistance to flex the muscle into something, like an elastic band, a door frame, bench, a friend holding your arm or leg. Flexing into the air sort of works, but it's best to flex it into something. It is an easy technique to do. To the observer, it may look like you're just doing the traditional stretch. If you can do multiple slight little flexes and stretches, you'll notice significant improvements and have greater range of motion and less pain with any appendage. If you're doing the traditional hamstring stretch, where you straighten your leg over bench, stretch the back of your hamstring and then keep your leg straight and flex the painful muscle downward into the bench. The same technique can be applied when stretching the pectoral chest muscle. Against a door frame, stretch your arm backwards, and when you feel that it is as far as you can stretch, then flex the muscle forward, focusing on flexing the painful chest muscle. If your neck is overstretched, and most people's are, it's due to your head being too far forward, from being on a computer all day, driving, or because you stand on the back of your legs. You can flex your neck and head back into a bed or flex into an elastic band. This will shorten and strengthen the back of your neck muscles, which will help one have fewer headaches. The StretchFlex technique will greatly improve your range of motion, and you will have less pain doing it, which will likely you to do more stretches. You just need to match the pain to the flex. It's very important. It is important to flex and stretch every appendage in both directions. Pain is usually from an overstretched muscle. However, just focusing on an overstretched muscle is only half the problem. By working both sides of the motion, you'll increase the integrity of your joint. This is often what carpal tunnel, computer mouse arm, headaches, and arthritis is all about. The joint is being pulled too often in one direction, and the pain is the indicator that the appendage needs to be balanced. This is also a major variable of arthritis. The joint is being flexed too often in one direction, then the joint is not in the right spot, then it inflames and then calcifies, and this is one of the variables of arthritis. In regard to how to walk correctly, the whole walking stride is the only time we are stretching and flexing. In step point 1, when you lift your foot before your heel hits the ground, you are flexing the front of your shin, the tibialis anterior, and after step point 4, you are pushing off your toe, flexing your calf muscle. This action can be the StretchFlex technique. Also, in the step point 1, you are opening your arch, and between step point 2 and 3, you are then flexing your arch. When you are using step point 1 and 2, you are flexing your outside leg muscles. When you are using step point 3 and 4, you are using your inside leg muscles. So in a single stride, you are using the StretchFlex technique 3 times. Any lack of flexing in any of these areas will create all the previous ailments that this book is about. Exercising the full range of motion in any appendage will help prevent and maintain all your joints. Sometimes muscles can be so tight that they are not stretchable. A massage 2 to 4 times a month will help loosen that muscle, and then the StretchFlex technique will be easier to do. Using the StretchFlex technique may prevent arthritis and any other potential injuries, which will hopefully keep you off the operating table. The StretchFlex technique only requires about 2 to 5 minutes a day, and after about 1 to 2 weeks you may notice some significant improvement. I think this technique is 10 times more effective than just stretching alone, and way less painful. By being aware of how to maintain your body and know when you're about to hurt yourself will lead to better health and overall greater spiritual awareness. Pain is the body showing you how to heal yourself. Pain is lack of awareness. Breathing, flexing, is bringing awareness back to the body. Often stretching is associated with pain, which is probably the reason why many don't do it. But if you flex the pain, you're putting awareness back into your body, and awareness in and of itself reduces pain. If you've ever taken an energetic course like Reiki, the basic technique is breathing and going into the space where the pain is. So if you can take your mind and your breath into that pain while flexing it, now you are linking together the spiritual, mental, physical components, and you're going to heal yourself way faster. This doesn't have to be even about leg pain, almost any other issue in your organs or anywhere else in your body. This is the basics of how to walk, the basics of how to heal. Good luck.